this was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time. Hello and welcome back to Wellness in Dentistry. Today's a good topic. Today we're going to be talking about career advice. So career advice both for people that are working clinically and just want to get better, want to have sustainable success, want to be able to do clinical dentistry for a long time. And then we're also going to talk about non-clinical career paths and, places where Martin and I have ended up that I think neither of us planned on.
Yeah.
And I am one of your hosts, Dr. Kyle Stanley. I'm a dentist, tech entrepreneur, speaker, and a researcher. And I am joined by your other hosts, Dr. Martin Mendelson. Martin is a disabled dentist, coach, speaker, and author. And his first book, One Move Makes All the Difference, comes out in less than a month. So it's still available for pre-order wherever books are sold. And then in early December, you will be able to buy it. And together, Martin and I, we have helped thousands of dental professionals pursue wellness in dentistry. So Martin, career advice.
Yeah.
Let's start. You and I have had interesting careers in dentistry, I would say, to say the least. We've both had our hands in many different areas, in many different sectors, from lab, career, speaking, tech, advisory, investment, coaching, facilitation. I mean, there's probably stuff that I'm missing, education.
Well, don't forget, I just got my insurance license too,
Oh,
which
yeah.
is something I never would have thought in a million years. So
Yes.
yeah.
Yeah. And that brings up a good thing. If you are needing to reevaluate your disability insurance,
Yeah.
contact Martin. We can put the link in the show notes too.
Mhm.
And Martin is a dentist that got disabled,
Yep.
and his disability insurance saved
Mhm.
him in that
Yeah.
sense.
Yeah. And, today, why did I go ahead to get my license? Because trust me, it was not an easy exam. I really did it to help other colleagues, just like I used to help patients. And there's insurance instruments out there that you may not even realize, like, key employee plans where, let's say you're a larger organization or even a mini DSO where you have an office manager that you couldn't deal without. Well, you can actually get plans to protect the business if that person ever became disabled or left or, gosh forbid, passed away, to be able to carry you through financially to find a replacement and train them, et cetera. So there's lots of things you may not even be aware of that I've learned all about. So yeah, if you want to chat, just hit me up anytime.
Yeah. So let's start with the clinical side.
Yeah.
Most people that are listening to this are clinical dentists. They either have their own practice or they're an associate or they work for a group or maybe they have a partnership.
Hmm.
But what is your advice for people that want to grow with avoiding burnout,
Yeah.
doing different procedures,
Hmm.
focusing on leadership, team culture? I would say people that want to grow sustainably.
Yes. Yes. Because when you use the word grow, my mind immediately goes to, okay, grow how, right? Because sometimes people are very focused, and this is observation, not a judgment or criticism, on the production growth. And so what do? They instantly say, okay, I'm going to start placing implants or doing molar endo, et cetera. And that always makes me wince, not because I'm necessarily opposed to that, but it's because we're doing it because the procedural value is higher monetarily, but that doesn't mean that our efficiency in providing the care matches. What I mean by that is, let's make this very simple. If it takes you 3, 4 hours to do molar endo or 2 visits, so it takes you 5 hours, well, that's not productive. And you're not making any money. In fact, you're probably losing money
Yeah.
doing that. So I want to first say, okay, how are we defining growth? Number one. Number two, how are we going to go about that growth? So if it's production, then I would take a step back and evaluate what it is you're doing today. What's the procedural mix? How long does it take you to do each of these? Then, therefore, what's your production per hour on average to accomplish these things? which of these procedures do you actually enjoy doing? Take a look at your consultations. What is your case acceptance percentage by procedure type so that you can actually understand where your gaps might be? And by the way, let me rephrase your case acceptance percentage, not just by procedure type, but by dollar amount. So maybe you're at 80%, 90%, 95% case acceptance for anything under $2,500. But the minute it hits five, it drops off a cliff. Okay, why? Right? So growth is about first understanding where you are versus where you want to go, and then how do you close the gap to go from A to B? That's what it is for me.
Yeah, what I'm thinking of right now is an Excel spreadsheet. So our earliest, one of the original group that started Pearl, there's a guy named Josh, and Josh was and just up until recently, was the VP of product.
Hmm.
So he was all involved with product and just an extremely smart guy. I'm actually really excited because one of the other um, startups that I advise called Two Front just hired
Hmm.
him. And so
Oh, fun.
I still get to work with Josh, so I'm excited about that. But he was an Excel wizard.
Mm,
He could take a bunch of data, which in AI you're doing all the time, taking a bunch of data, analyze it with Excel so that you have kind of heat maps where
yeah.
it's color coded, where it's like more green or more red and different colors. And I was
Mhm.
thinking about that as you were saying that, which is the self-awareness of cross-referencing the procedures that you do, the procedures that make you money, and the procedures that you like.
Yeah.
Because
100%.
that little triangle is
Hmm.
so powerful. Because
Absolutely.
you may have things that you really enjoy doing that you don't make any money on. And I don't want you to say, well, I'm like, I shouldn't do that anymore. No, if you really enjoy it,
Right.
do it. It's like me cutting the grass. I could pay someone nothing to cut my grass, but I
Mhm.
enjoy it. So I do it, right? It's not
Yeah. Yeah.
efficient. I'm not doing
Yeah.
it efficiently, but I enjoy it. It's kind of a fun
Yeah.
thing that I do. And on the opposite side, if you find something that is making good money and you love doing it, heck, you could lean into that. And
Oh,
maybe you
yeah.
could delegate some of the other stuff if you have an associate or a partner like
Right.
that. But I
Right.
think I love what you were saying because it starts with that self-awareness that I believe most people don't have. I was one of them. I had no idea what my case acceptance rate was when I
Mhm.
was going through burnout.
I
I
didn't
didn't
even.
know what my production per hour was. And I would probably even say that there were things that I did that were high ticket that
Hmm.
I probably made less money on because I took so long doing,
Exactly.
you
And
know.
by the way, one thing we didn't say is if there are things that frustrate you, then do the same evaluation. And if it frustrates you and it's taking
And
you longer, then if you have the ability to do this, then eliminate it out of, refer it out, right?
yeah, I mean, I've mentioned them before, but my friends Ritter and Ramsey over in
Hmm.
Florida, they have a restorative practice.
Hmm.
And I mean that very specifically.
Yeah.
They do restorative dentistry.
Yep.
They do fillings, inlays, onlays, crowns, bridges,
That's it.
you know, uh, implant restorations. They
Correct.
don't do extractions. They don't do wisdom teeth. They don't do implants. They don't do endo. They don't do ortho. They don't do
Yeah.
anything. And they're
Yeah.
very successful. They know what they like. They have great specialists that support them. And I think there's this feeling now where you have to do everything. And I was definitely one of those dentists too.
Yeah.
I think because I was trained both on the perio and the pros side that I felt like, oh, I kind of should do everything. But you have to have that self-awareness. I think that is a really good starting point.
Yeah. Absolutely. And it that can extend to your life too. Like in my online course, I actually have a whole lesson and some very simple on purpose Excel spreadsheets to figure out how you're spending your time. And
it's
are
a
there
great spreadsheet, by the way, for anybody
yeah,
that,
it's so simple, but it's so powerful, right?
yeah.
And so, like one of the examples I give in my course is like making dinner in the evenings. And so, if it's taking you 2 hours to put dinner on the table, well, what are your options? What are your alternatives? If you could maybe cut that down to 20 minutes, now all of a sudden, you know, minus eating, you have an extra hour every single night. That's 5 hours a week. That's, 5 times 4 is 20 hours a month. Like, holy smokes. That's not something to sneeze at. That's something to consider. So you got to start with the data, whatever the data happens to be. In our case, we're talking about clinical data, we're talking about case acceptance data, production per hour data, but don't forget the subjective data around, I really hate doing X. Okay, well, if you hate doing X and you're not that efficient or proficient, and then therefore your production per hour on doing that is much less than the other thing, why are you doing it?
Yeah, you know what I think is a big one with this, and
Hmm.
take what I'm saying with a grain of salt because I do have equity in this company called Two Front,
Hmm.
is aligner therapy.
Hmm.
I know a lot of dentists, and again, I was one of them,
Hmm.
that goes and takes a weekend aligner
Yeah.
course and then thinks they can do aligner therapy efficiently. I'm not saying you
Hmm.
can't do aligner therapy.
Right.
You'll eventually move the teeth. But I got to this point where I was doing a case that probably would take a specialist 8 months in 18 months.
Absolutely.
And you
And
look at
it's,
my cost per
yeah.
hour, and I was
Yeah.
like losing money on these cases, thinking, oh my gosh, I'm keeping them in house. And
Yeah.
oh, I sold this case for 5 grand. I mean, that's 5 grand. Yeah, but I took 10 hours to do it, right?
Correct.
So I made
Yeah.
less than if I was doing 2 fillings.
Correct. Yeah. I've been accused of being against aligner therapy in the GP office. I'm not going to say I'm against it, but I'm also very cautious purely for productivity reasons. Because
Well, I mean,
most,
don't get me wrong, there are GPs doing aligners that are incredible.
oh yeah,
Just like there are GPs that are doing implants that are
yeah,
amazing,
of course,
right?
of course.
Um, but if I were to generalize, I
Exactly.
would say most are not amazing at it.
No. And they're not efficient on top of it. So like that's a recipe for disaster.
And so when you think of what you could be doing in that 10 hours, let's
Hmm.
give that example that I gave, right? You're charging 5,000 for
Hmm.
comprehensive aligner therapy. You're doing 10 hours of chair time. So it's
Hmm.
$500 an hour, right?
Yeah.
What if you did 10 crowns?
Hmm.
You
Yeah.
probably do it in
Well,
less than an hour.
yep. Well, I'll make it even more crazy for you. What if you ran the math and you're currently working 4.5, 5 days a week, and all of a sudden you realize if you start focusing on the stuff you like and you're productive at, you can cut out a half to a full day a
Mm,
week.
right.
And it's not crazy. It's not impossible. It's very doable, but
Yeah.
it has to be done with intention. And it
Mm,
has to be done with planning. It has to be done with a scheduling template. It has to be done with support by your administrative or, front office team. But it can be done.
yeah.
Absolutely can be done.
Okay. Now, what if people do want to diversify? Let's say they
Mhm.
really do want to do implants, for example.
Yeah.
Then how do we think
Yeah.
about bringing that in from a career standpoint?
Yeah. Well, there's a couple different ways you could do it because you said bring it in, aka to the practice. So
True.
you could bring somebody into the practice, which I'm not the biggest fan of for a couple of reasons. I think it from a relationships perspective in our community, it's not going to be looked upon too kindly by your surgical specialist in the area. And why is that important? Well, because if you're bringing somebody into your office, how many days a week are they going to be there? One, two? How are you going to handle emergencies? What are you going to do when the untoward things happen? Like,
It's challenging. I've been that
yeah,
specialist
yeah,
being brought in for
yeah,
that. I was basically a traveling
yeah, yeah.
implant and sedation and surgery
Hmm.
guy for many years. It was challenging for me because that
Yeah,
would happen. I would
yeah,
have something, and then, 3 days later, when I'm in another city, they're like, "Hey, um, the patient said that this thing is loose, and like, what do you
yeah,
want us to do?" And I'm like, "Well, I'm not going to be back for another 3 weeks at your
yeah,
practice,
yeah.
it was challenging.
I think, so the other way to go is obviously get additional training and start providing these procedures in-house. And if I were going to do that today, I would actually do that in concert with my surgical specialist. 100%. I would approach them and say, listen, I'm thinking about doing this. I'd like your help and mentorship. I'm not planning on not using your services anymore. However, I would like to gain some experience in the more straightforward, I didn't say simple, implant placement procedures. What do you think? And that's going to tell you a couple things right then and there, because the best interdisciplinary relationships I've ever seen are the ones that both parties are very growth mindset oriented, where the specialist understands that general dentists are going to be doing, excuse me, general dentists will be placing implants anyway, more and more and more over time.
Yeah.
And so, why not be part of the solution than a roadblock? And I mean that from a patient perspective, because ask any surgical specialist how many implants they have to remove and correct because somebody who was not as experienced placed it incorrectly. Nobody wants that.
Hmm.
So, I would actually do it in concert with my surgical specialist,
I
whether
mean, what
that's
you
your,
said, I
yeah,
completely agree with, but I
yeah,
also know there's a lot of people listening that are
yeah.
like, that I am so scared of my specialist.
Oh, I
And
know.
he or she
Yeah.
knowing that I'm even interested.
Yeah.
And I feel their pain because I know a lot of specialists
hmm
that would be angry
Yeah,
about
I
this.
do too.
Yeah.
I can tell you, I'll tell this story now because it's almost 10 years old. Like almost 10 years ago when I was at Spear, Spear launched a course first, which I thought was a good idea at the time, although I was a little worried. It was an implant placement course, but you couldn't come as a GP without your surgeon. You couldn't do it.
Genius.
And I thought it was a really, really good idea because I thought it was going to elevate everybody else. Well, this is public knowledge. The president of the AAP at the time did an editorial in their magazine about how evil it was. And I was at our summit with a surgical specialist. I won't even say where, I won't even say male, female. And this individual was just yelling at me.
Great.
And
Mhm.
I looked at this individual and I said, so let me get this straight. You would rather have a GP mess it up and have you fix it than help them to do it right to begin with. And he goes, yeah. And I said, how is that good for people? You know?
Yeah.
So yeah, you're not going to win with everybody. And I'm getting old enough, I don't care. And if we're in this business to A, treat patients and B, make a good living, then fall to point number one, folks.
Yeah.
That's what I
Well,
gotta say.
I'll tell you this. I've met thousands of specialists, thousands of GPs, and I'll tell you the specialists that understand that some of their GPs are going to do
Yeah.
some of their specialty procedures and they're there to support them.
Yeah.
They get so many more referrals,
Oh my
so
gosh.
many more. If you're
And
like, oh yeah, that's awesome. Like, yeah, you place this. Let me tell you what I do, and this is what I do. That person will still refer to you because they're not going to do the one where there's a sinus lift or they have to do vertical or horizontal ridge augmentation or where it's a central incisor where they're
totally.
doing immediate placement or whether it's
Yeah.
an all-on X case or whether it's
Yeah.
an overdenture case. They're not. I mean, very rarely do you have people that get to that level from a GP standpoint. And when you can be a specialist, so I'm speaking to you specialists out there, when you can be a specialist where someone doesn't feel intimidated by
hmm
you, they feel
hmm
supported by you, oh my gosh, your practice will explode.
Oh, 100%. And think of it this way. Do some simple mathematics. If you were referring 2 cases a month to a specialist and 50% of those cases were single implants, now all of a sudden you're placing most of the single implants, but guess what? Now your perspective changes. You are looking at the case differently. You see the opportunities differently. You understand how to talk to a case acceptance perspective better. Now all of a sudden you're referring the same two cases in number, but instead of an average case value of, let's say, 2,000, it's now 4, 6, 8, 10.
It's so true. And I see this time and time again.
Yeah.
For about the first 10 years of my speaking career, I was going around teaching people how to place and restore
Mhm.
implants. That was a lot of what I
Mhm.
focused on. And I saw this all the time. And I trained specialists and I trained GPs. And what
Yeah.
I saw with the GPs was that the GPs that understood surgery and took these courses, they started referring more because they started seeing the opportunities.
Hmm.
So
Yeah.
they may start doing their own socket grafts, but they're not doing
Mhm.
horizontal ridge augmentation and sinus
No.
lifts and vertical ridge augmentation. You maybe have 5% of the people that will
Mhm.
go on and be proficient at that. But they're focused on surgery now and they see these
Yeah.
opportunities. And if you can be there to support them, your practice will thrive and you'll have a great relationship with your specialist.
100%.
I know
100%.
I've told this story before on the podcast, but I think it's really important. When we moved in to our building, when we bought our practice, there is an oral surgeon there, and his name's David Salahani. Great guy. And I was intimidated because he asked me to go out to lunch a few months after we bought the practice, and I was like, gosh, do I tell him? Like, does he know that, I did an implant specialty and
Yeah.
I do my own sedations and I do wisdom teeth and I did a lot of what a traditional specialist would do. And he took me out to sushi lunch. I still remember this. And we walked back to the office and we got to the elevator and I said, "Hey, David, I'll refer you, I'll send over some wisdom teeth patients for you." And he said, "We can just be friends." And I was like,
Wow.
"Wow, that's
Yeah.
amazing." Now, over the years, I referred a ton of stuff to him.
Yep.
you know, wisdom teeth cases that were real deep, that were challenging for me, but are a cakewalk for him. Big reconstructions, full arch cases, sedations on medically compromised patients. I mostly sedated children or like ASA type 1
Hmm.
patients. And we had a great relationship. We still have a great relationship.
Hmm. Yeah.
And I think it goes to say that both of us had a growth mindset.
Yeah. Absolutely. And so, to some degree, I think we got off on a little bit of a tangent, but I think we're still we're still in the same theme here, which is okay, if you want to grow your practice and you want to create resilience for the long haul, do the stuff that you like, do the stuff that's productive, and be analytical around the things that are sucking your time that you
Yeah.
also don't enjoy, right?
Yeah. And before we go to the second part of today, which is more of the
Hmm.
non-clinical
Yeah.
path that Martin and I have ended up in accidentally, I think, I do want to say one of the big advices that Martin and I have is focus on non-clinical things for your clinical stuff. So
Yeah.
what that means is focus on communication, setting
Yeah.
expectations, boundaries, leadership, team training, team cohesion. Have Martin come out and do a culture constitution for your group.
That's our new name. That's our new
Yeah.
name that we figured out at last recording session. Yeah.
And that is really what's going to take you far.
It's interesting. I just to close this loop, I was talking to one of my private clients today, and this is a dentist, and they were a bit frustrated by an assistant's cell phone use.
Mm,
And I said, "Is it documented?" He goes, "Yeah, it's in the handbook. They signed it." I'm like, "Great." I said, "When you see this behavior, what do you do?" "Well, not much." And I said, "Look, we don't have to make this complicated. If you've gone to the effort of having the structure and clarity and having it documented, it can be something as simple as, hey, just a reminder, this is against our policy. Please put your cell phone in the break room or what have you. And then if you see it again, then you make it a larger conversation. Like, don't shy away from this stuff." So,
I
yeah.
think it goes back to what we talked about, I think, last episode or the episode before that, which is things festering.
Yeah,
We
totally.
have to stop it when it's happening.
Yeah. Yeah.
Okay, let's transition a little bit
Yep.
because I know you and I get this from a lot of dentists.
Yeah.
Dentists will say, I mean, you look at some of the statistics, there's a statistic that we talked about last episode, how almost 25% of dentists are likely to leave the profession in the next 2 years.
Yeah,
And that is a staggering statistic, I think.
yeah, yeah.
But I have people all the time, mostly people that are burnt out, that tell me like, "Hey, does your AI company need any more dentists?" Or, how
Hmm.
do I get into speaking? Or,
Yeah,
"Oh, I heard that you are the clinical director of a lab. How can I do that?"
yeah,
What
yeah,
advice do you have for our colleagues that are thinking about transitioning or maybe just putting their toe in the water of what's available from a non-clinical standpoint?
yeah. I think the first thing I would say, which is incredibly self-serving, is buy my book because the whole theme of the book is how to get yourself unstuck. And there's 10 exercises in the book, and I actually have more. I'm going to be creating a workbook. And the first one starts with this wheel of life exercise that we actually do in our Light Side Live course together about understanding where your life is out of balance. Then we start into exercises around, where am I? Where do I want to be? What's the gap, if you will? Then we go into limiting beliefs about what you believe about yourself, your world, your realities. So buy the book. But I think the answer is where to start, I believe is your question.
Yeah.
It's taking an inventory of what it is you like to do, what it is you believe you're good at, what it is you're capable of. That's the best, most 80,000 foot place to start. Because actually, let me rephrase. I'm sorry.
Okay.
Let me take a step back.
Okay.
If you're looking to get out of dentistry because you say, I hate dentistry, then my first question is going to be to you, do you really hate dentistry or are there aspects of dentistry that you hate?
Yeah.
That's where you need to start. So my apologies to everybody for getting off on that tangent of evaluating what you like and what you're good at. That's actually step two
Hmm.
after we overcome step one, because you and I have both seen this time and time again. People are like, I'm miserable. I don't like this. It's like, okay, well, what do you not like?
Yeah. And they say, "Oh, I hate dealing with staff."
It's like, okay, well,
Yeah.
then within reasonableness, if we can get away from doing that, then get away from doing that.
Hmm.
Sounds simple, not so easy,
Yeah.
but it is simple at its core. So, I don't mean to be flippant, but I just spoke last week. We're recording this in September, but I just spoke last week at the American Association of Dental Office Managers. There were some pretty amazing humans in that room. In fact, there was 1,500 and there was a 300 person wait list. So
Crazy.
find yourself a really good, qualified, accredited, fellow. It's like FADUM, DADUM, MADUM, all the different designations, and pay them for their expertise to have them take that stuff off of your plate. If there are clinical things you don't like, I'll reference the first half of this podcast. But I think it's really evaluating the global catastrophic statements where it's like, I hate dentistry. Okay, wait a minute. What do you hate about dentistry?
Hmm.
Is where I would start.
Yeah. My advice is different. I agree
Yeah,
with what you're saying. My advice is to be better. I would say diversify your knowledge of the dental industry.
sure.
So what I mean by that is I have a lot of dentists that come to me and say, "Hey, I really want to transition out of clinical dentistry. Um, does your AI company need any more dentists?" And I'm like, "Well,
Yeah,
tell me about yourself. Like what do you know? What are you good at?" And they're like, "Well,
yeah,
I've had a practice for the last 15 years and okay, so what is they're like, I'm really good at clinical dentistry." I'm like,
great.
"Okay, well, so is every dentist, right?" And so how are you going to get a job where you have 100 other dentists applying for a tech company, for example?
Hmm.
What makes you different?
Yeah,
Now, I think for me, how I was able to be successful, which I ended up in the non-clinical world, I never planned on that, was I always had my foot outside of the practice as well. So for me, that started out with university. So I was a clinical dentist, but I taught at the university. And
Yep.
because I was always involved with research, I knew about research. And
Hmm.
then research got me into speaking. So then I knew about
Hmm.
speaking. And then the speaking world introduced me to corporate sponsors that were sponsoring
Yeah.
my lectures. So then I started learning about the marketing aspect of how implant companies are thinking
Hmm.
about this, go to market strategy of new products that are coming out, different markets in the world, right? So what's different in Europe than what it is in Canada? And how about
Yeah.
Brazil? And how's that going? And it kind of snowballed for me to where
Yeah.
just out of school, I already diversified myself because I was a university professor and the private practitioner, and I was a speaker. And then it was like I'm doing research too, then I'm speaking, which it sounds overwhelming, and it was because I was
Hmm.
always
Hmm.
doing a lot. But that was, I think, what led me to be successful in starting a tech company, to
Yeah.
advising companies, to eventually becoming an investor in companies as
Hmm.
well, to where my non-clinical endeavors needed more of my time. Because a lot of people ask me, it's actually I misunderstood. A lot of people think that I quit clinical dentistry because of my
Mm.
burnout, which actually wasn't the case. I
Right.
practiced for 5 years after burnout.
Right.
And I ended up transitioning just because my AI company needed more time. And from a financial standpoint, it made more sense for me to go that way. And so I think for me, now when I talk to dentists that are looking to transition out, I tell them to try to understand our profession more instead
Yeah.
of just their job.
I agree with you 100%. And if I just replay the cliff notes of my own career, it's the same thing, but because I didn't have a choice in a
Yeah,
way. So
yours was your choice was
yeah.
given to you.
So I became disabled. Then I worked for a lab, learned the lab side. And while one of my job duties was teaching an assistant course and speaking on color science because it was the number one cause of remakes, that then led me to Vita because I was speaking on color. That then led me to Spear because talk about intimidating. We joke about it today, but I went up to Dr. Spear and Dr. Kinzer's practice, and I gave Greg Kinzer my color lecture just one on one. Talk about
Oh
intimidating.
my gosh.
And he told me later that was one of the reasons he was like, yeah, his stuff's solid. Like, we should
Yeah.
hire this guy. So I ended up going through this progression of understanding clinical, lab, corporate, education. Then while I was at Spear, I started down the whole coaching route. And
Yeah.
so, for me, I often call it as a journey through just necessity, if you will. But if you think about it, you and I had the same journey, just with a different impetus,
Trigger,
if you will.
a
Trigger.
different,
Yeah, yeah, yeah,
yeah.
yeah,
Trigger
yeah.
not in a bad way, but
Yeah. So it's an answer, but it isn't an answer, right? Because there isn't an answer that happens immediately. And so I think your advice is amazing, which is understand and diversify yourself within the larger aspect of dentistry, right? Because I know we both know dentists that started out as clinicians and now they're like regional clinical leads in a DSO, and
yeah.
they have people, team members and or doctors technically reporting to them and stuff like that.
Hmm.
And that's a journey too, right?
Yeah.
So yeah.
Yeah. And it's funny if we go back to the first part of this episode, it's similarly that for young doctors too. I
Yeah.
remember I got back from my residency in Brazil, which was based around like a perio-pros kind of a residency. And I got back and I had so many job offers
Mm,
because although I was just less than 2 years out of dental school, I
mm,
could sedate patients,
yeah.
place implants. And you had people that were coming out of dental school that maybe even had more experience than me, but they were like, I'm a restorative dentist.
Yeah.
And so you have these practice leaders that want to bring in an associate And maybe it's just to offload stuff to them, but hey, maybe if they could add to the practice. I
Totally.
had so many job offers because everyone
Mm.
wanted an associate that could add something to their practice
Totally.
instead of just doing what they did. So it's kind of the same thing when you
Hmm.
think about the non-clinical route.
Totally.
And how I think about the growth of learning new things is that it's similar to how I advise people on doing new clinical treatment. So let's
Hmm.
say you're getting into placing implants. You want to push yourself enough to where you are growing, but
Hmm.
you don't want to push yourself enough to where you're so uncomfortable that you get in trouble, right?
Yeah.
And this is the same way with gaining knowledge to do more non-clinical things. It's like push yourself enough to where, hey, now maybe I'm learning a little bit about the lab side. I'm
Hmm.
understanding the blocks and the overhead and
Yeah.
turnaround time and delegation and remakes and how the lab works. And then then that allows you to understand maybe the manufacturers that are
Hmm.
you're getting the blocks from or you're getting the
Exactly.
printers from. And I know that for me in my career now on the KOL side, so when I'm speaking with companies sponsoring me, they always say to me like, it's so nice because you understand go to market. You understand how we're
Hmm.
marketing.
Yeah.
You understand overhead and how to speak to that. And it's like I become more valuable
Oh
because
yeah.
of my generalized knowledge.
Hmm. Totally. And it's interesting. I had this experience. I don't remember who I was talking to, but it was somebody in a corporate role. And I used the phrase that some of you may be familiar with that quote, I carried a bag. And that means that you were involved in sales. And
Mm.
so the minute you say that to a corporate person, they go, really? You were? Tell me more about that. What
I've
do you
never heard that actually. That's funny.
Oh, really? Yeah, yeah, yeah.
Yeah,
It's,
yeah,
it's I carried a bag. Like I think it comes from like the door-to-door salesman days. That's
yeah.
that's where it comes from. But I and shout out to actually Laura Brenner because
Mhm.
if you're in a place where you have made the decision, I've got to get out, you've considered, the things that we've talked about here, and you're just like, no, I want to get out of dentistry. Laura is fantastic. She's made an entire coaching practice out of helping dentists get out of clinical practice.
Yeah, and Laura is
Yeah,
a dentist who
yeah,
transitioned out of clinical practice.
yeah. And I think I'm a great coach and I coach people all day long. And that is a specific niche that
Yeah.
Laura is just fantastic at.
Yeah, I've referred a ton of people there because
Me too.
Martin and I have people that take our online courses or our in-person courses
Yeah.
together. And our goal is to keep people in dentistry.
Yeah. Yeah.
We want you to thrive in your practice and thrive
Hmm.
with your clinical work and thrive with your team. However, we do have people that say, you know what? I took the course and the course was great and I learned so much, but
Yep.
did some soul searching and I finally just decided like
Exactly.
this is the wrong profession for me.
Yeah.
I don't like it.
Yep.
I've never liked it. I'm really suffering from it and I really need to transition out of it. And that's not what Martin and I do. Although
Mm-mm.
both of us have transitioned out of clinical
Yeah.
work.
Yeah.
Um,
Because
we are
she
really
she
trying to
has
keep
all
you
kinds of frameworks and
yeah, but
methodologies, and she's
that's what
really
Laura
locked us
does.
down.
I have multiple people that I've referred to her, and everybody's been very, very happy. So, final thoughts. We talked about career advice, both from a clinical standpoint, how
Hmm.
to grow your career, how to grow your practice
Hmm.
when you're in your practice with your team and
Yeah.
you're doing new procedures and working with
Yeah.
specialists. And then we also did touch on if you're interested in some of the stuff that Martin and I do and you do want to transition out, how to get there. What are your final
Yeah.
thoughts?
My final thoughts is both have the same path, which is where am I today? Where do I want to go? And then how am I going to figure out how to get there? It's classic coaching 101. It's just two different scenarios. End of story.
Yeah, I don't think I have anything to add to that. It's it's simple but not easy, like
Yep.
anything. And yeah, if you guys are interested in anything that Martin and I do, if you do want to check out our online courses, our in-person courses, our coaching stuff that we do, or anything that we do, just go to wellnessinDentistry.com and go to our links. You'll see everything there. And we would appreciate it if you would share this, send it to a colleague that may be thinking about that they want to grow their career in one way or another, whether it's clinical or not. We hope that this was really helpful, and we'll see you on the next episode. Ciao.
Take care.